Epilepsy is a brain disorder that occurs when changes in brain tissue cause repeated seizures. Epilepsy is diagnosed in 125,000 Americans each year and is a lifelong problem and affects people in many different ways. And joining us this morning with more information is Neurologist Doctor Bruce Fisch and patient Whitney Bullock. Thank you both so much for joining us today. You know, this is a very relevant topic. We just heard about some celebrities going through this. I know Kelly Osbourne. I know people personally that have been through it. So, doctor, could you please just give us a basic understanding, first and foremost, of the disorder in the first place, what it is?
And even the Chief Justice of the United States.
That's right, that's right.
Well, epilepsy is a disorder where you have recurrent seizures. And if you have epilepsy, the main thing is you're not alone, because 1 in 100 people have epilepsy.
That's amazing.
So the difference between epilepsy and seizures is anybody can have a single isolated seizure. People with epilepsy keep on having them. So 1 in 20 people in their lifetime are going to have a seizure, but 1 in 100 will have epilepsy.
Interesting. I didn't understand that
before.
It's
very common.
It's a lot more common than a lot of us think, but epilepsy is not a one-size-fits-all problem. I mean, it does affect different people in different ways, correct?
That's right. We don't even refer to it as epilepsy among professionals. It's the epilepsies, because there are so many different types, so many different causes. And as the population's getting older, it used to be that the main time of onset was in childhood and adolescence. Now it's more common to start in the elderly.
Well, I want to talk to somebody who's been through it. Whitney, thank you for being here, first of all, and sharing your personal story. Tell us how epilepsy affected your life.
That's a good question. I think it affects you differently as you age. As a child, it was very difficult to keep up with my peers in school, you know, having seizures at night, during the day, constantly tired, and then the side effects of medication, trying to keep up with the learning rate, you know, and then entering the work field. Transportation became a huge issue, you know, not having a driver's license, and I come from a smaller town with 0 public transportation. And then, so it changes with age, you know.
And you learn, and you have to learn to live with it, but you have to learn to get the treatments. It is possible, and you're a great example of that. And doctor, you can tell us a little bit about how epilepsy is treated so people can understand. Yeah,
well, there are 4 different kinds of accepted modes of treatment. The first is medications. Then there's something called a ketogenic diet, and actually there are a few different diets that seem to be helpful for epilepsy. There's something called a vagus nerve stimulator. It's an implantable device. And then finally there's epilepsy surgery, which is the only potential cure we have for epilepsy, but not everyone's a good candidate for that.
Well, what if medications don't work? Then what?
Well, if medications don't work, and there's 2 reasons they could not work. One is just they're not effective, or side effects, because 50% of people with epilepsy complain of side effects. They just have to take their medications, but there's some with more or less. But the first thing you would want to do is see if you can get yourself to an epilepsy center.
And we're actually looking at a map right now. Tell me a little bit about what we're seeing.
Yeah, this is a map of the epilepsy centers in the United States that are members of the National Association of Epilepsy Centers. And it means they can provide a comprehensive approach. Everything from medications to the other therapies I mentioned. But a lot of people go undiagnosed for a long time. A lot of people have the wrong diagnosis, and you want to get yourself to a facility at least at one point to make sure that you understand what you have and what the best treatments would be.
I'm going to interrupt you for a second because I want to ask Whitney real quickly. I know you had the surgery, correct? How has it changed your life?
Wow, from anywhere from being able to live on my own now to having a driver's license and being able to drive a car. I now know what it's like to sleep through the night without having a seizure and being able to wake up rested. And I always thought I was sleeping, but I never was until I realized what it's like. It's
now
amazing.
You know the truth of what it feels like.
Yes, I could go on forever, but it's giving me confidence. It's giving me dignity, and you can ask anyone who knew me before and now, and I just have a completely new outlook on life. It's absolutely
You're
amazing.
giving so many people hope. Thank you so much for being here, and I'm so
do.
happy for you. And thank you so much for sharing such important information, doctor.